So what we just saw here is a patient inserting her own NG tube, which normally nurses in the hospital would do this for a patient, but it seems like this individual is doing this at home and has a lot of experience doing so. Let's quickly go over NG tubes, what they are, how we insert them, and what to watch for as a nurse. An NG tube or nasogastric tube goes through the nose, down the esophagus, and into the stomach. It is used for feeding, medication administration, or gastric decompression, like in bowel obstruction or a post-op ileus. Before inserting, nurses measure from the tip of the nose to the ear to the xiphoid process, and this is how we estimate the correct insertion length. We lubricate the tube, position the patient upright if possible, and then ask them to swallow or sip water as we advance the tube. This helps guide it down the esophagus instead of the trachea. And you can see how she's controlling her breathing really well here. This is great. If the patient starts coughing, turns pale, or can't talk, we of course stop immediately because this could mean that the tube has entered the airway. Before using the tube for anything, we have to verify the placement. Gold standard in the hospital is an X-ray. This is what confirms that the tube properly ends in the stomach. And nurses, remember to always document the tube length at the nair. If this length changes later on, it may have migrated. So again, self-insertion like this isn't typical. In hospitals, NG placement is strictly done by trained staff. It's a simple procedure, but it carries real risks if placement isn't verified correctly. There could be aspiration, pneumothoraxes, or feeding into the lungs.